Hello, my name is Olivia Martin, and the new technology I want to discuss is the muscle rehab sensor-based suit. This suit represents a major breakthrough in telerehabilitation, benefiting both physical therapists and their patients. But how do and can the makers of the suit combat comfortability issues and safety risks? According to Zhu and colleagues, the muscle rehab suit solves the issue of there not being enough physical therapists to treat the growing population of seniors, especially those with severe health problems or transportation issues. The current solutions in place rely on the patient routinely performing the exercises as well as assessing themselves, which is not as reliable as having a physical therapist present. Zhu and colleagues state that the muscle rehab suit uses electrical impedance tomography, a technology that has been incorporated into a wearable suit to allow physical therapists to visualize what muscles a patient is engaging using a virtual avatar of the patient. This technology is further aided by optical motion technology, which directly tracks the patient's movement. Zhu and colleagues describe that the issue of not having enough physical therapists is solved because the user is able to use the suit unsupervised, and the physical therapist is able to analyze the patient's data later on. While wearing the suit, a virtual reality headset immerses the patient in a virtual environment. Patients are able to view themselves and the muscles they must engage, and this allows patients to perform more accurate self-assessments. I was not able to contact the creator of the suit. However, when I did, I asked a few questions. How do patients that experience vertigo from using virtual reality technologies combat this issue while wearing the suit? How are accidents that happen when the suit is worn addressed? And what are the safety protocols involved with suit usage? According to Chang and colleagues, patients that use virtual reality technologies may experience symptoms such as nausea, disorientation, and eye fatigue. The issue is not that the screen needs to be a higher resolution. The key issue is ensuring what the user is doing in real time matches what he or she sees on the screen of the headset. Additionally, if the user is able to feel, hear, and even smell his or her environment while seeing it virtually, the user may not experience the symptoms of vertigo as severely. Chang and colleagues emphasize that it is important to understand that each user's experience is subjective, and the symptoms of vertigo typically lessen as the user continues to expose his or herself to a given virtual reality environment. According to Lee and colleagues, it is up to the physical therapist to decide whether or not using certain technologies during telerehabilitation is appropriate for each individual patient. All risks must be considered and prevented before the patient can undergo telehealth treatments. Lee and colleagues also state that it is up to the physical therapist to both manage and document accidents that occur during telerehabilitation. The authors state that a key way that physical therapists avoid accidents is by informing patients of the risks involved with the treatment, and then the physical therapist would obtain the patient's consent. According to the Federation of State Boards of Physical Therapy, physical therapists must treat patients that use telerehabilitation no differently than how they would if the patient was physically present in a clinic. Additionally, patients cannot begin telerehabilitation until they have been assessed in person by a licensed physical therapist. All in all, Zhu and colleagues state that the muscle rehab suit allows for physical therapists to have a better understanding of patients' progress by allowing them to go back and review all data collected by the suit. And since patients are able to more accurately assess their muscle engagement when using the muscle rehab suit, his or her physical therapy program can be made more effective. It is crucial that the data collected by the sensors and the data that shows on the screen is synchronized so that the patient and physical therapist assessments are accurate. And based on the research performed by Cheng and colleagues, this fact means that patients will not experience vertigo due to delays in what they feel and what they see. Zhu and colleagues show that the material of the suit is thin and does not cover the hands or feet. And the research done by Chang and colleagues shows that patients should be able to lessen symptoms of vertigo by being able to feel his or her environment. With this information, it is possible to conclude that the suit itself should help to lessen the symptoms of vertigo. Based on the information provided by the Federation of State Boards of Physical Therapy, the safety protocols involved with using the muscle rehab suit should be no different than the safety protocols for being in person at a clinic. Based on the information provided by Lee and colleagues, physical therapists are responsible for preventing and managing accidents that occur while the suit is being used, just as they would be for any type of telerehabilitation. Thank you all for listening to my presentation, and I invite you to consider how we could all teach our older friends and family about new technologies that could improve their lives.